Have you ever noticed how your body whispers before it shouts? How a slight change in your morning routine or a fleeting moment of confusion might be trying to tell you something important about your health? Most of us spend our lives listening to everything except these quiet signals our bodies send us, especially as we grow older and wiser. Today, we're going to explore something that many people avoid discussing but absolutely need to understand. We're talking about the subtle signs that indicate when someone's body is preparing for life's final transition. This isn't about fear or sadness. This is about awareness, dignity, and the gift of being prepared. Whether you're caring for a loved one or simply want to understand your own body better as you navigate your 70s, 80s, or beyond, this conversation could change how you approach the precious time we all have. Let's begin with perhaps the most visible sign, one that often appears so gradually that families might not notice it until they look back months later. We're talking about a noticeable decline in physical strength that goes beyond the normal aches and pains of aging. Picture this. Your father, who always prided himself on independence, suddenly struggles to rise from his favorite chair without pushing off with both arms. Your mother, who loved gardening, now finds it difficult to lower herself to the ground at all. These aren't isolated incidents. The person begins moving more slowly, with visible hesitation. Their shoulders may curve forward slightly. Their grip weakens noticeably when holding a coffee cup. They might shuffle their feet instead of taking full steps, and their gait becomes uncertain, almost tentative. What's happening inside the body is both complex and completely natural. As we age, particularly in the final year of life, the body begins prioritizing its resources differently. Muscles start breaking down faster than they rebuild because the body no longer sees muscle maintenance as essential. The cardiovascular system becomes less efficient, meaning less oxygen-rich blood reaches the muscles with each heartbeat. This creates a cascading effect where weakness breeds more weakness. You might also notice that appetite often diminishes during this time because the digestive system itself is slowing down. The body requires less fuel because it's doing less work. Forcing someone to eat when their body is naturally reducing its needs can actually cause discomfort, bloating, and nausea. If you notice these signs in someone you love, the most important response is gentle support rather than aggressive intervention. Respect their limits. Don't push them to exercise or stay active if their body is telling them to rest. Emotional support becomes far more valuable than physical therapy at this stage. Sometimes the kindest thing you can offer is simply sitting together, holding a hand, and acknowledging that you understand they're tired. The second sign involves something we all need for restoration, but in ways that change dramatically as the body prepares for its final transition. We're talking about sudden, marked changes in sleep patterns and overall alertness. This goes well beyond taking an afternoon nap. This is a fundamental shift in how much time the person spends in a sleep-like state. You might notice your loved one sleeping 14, 16, even 18 hours out of every 24. They doze off frequently during the day, sometimes mid-conversation. When they are awake, their alertness fluctuates noticeably. Their eyes might seem unfocused or distant. Their attention span shortens dramatically. They might ask the same question multiple times within minutes, not remembering they've already asked. As oxygen levels decrease throughout the body, the brain receives less of what it needs to maintain sharp consciousness. Brain metabolism slows, meaning the organ that controls everything begins operating in a different mode, one focused on essential functions rather than complex processing. This isn't depression. This sleep-heavy state is more about the body conserving every bit of energy for core functions. For families, the most compassionate approach is to allow the rest they need while being present during their wakeful moments. Sit quietly nearby. Speak softly when they're awake. Don't feel compelled to fill every silence with words. Sometimes your steady, quiet presence provides more comfort than any conversation could. The third sign often breaks hearts because it seems to contradict everything we know about the person we love. It involves a noticeable withdrawal from social connection. The person who once loved family gatherings begins pulling inward. They decline invitations. They keep phone calls brief. When people visit, they seem less engaged, offering shorter responses and fewer questions. This withdrawal isn't rejection, though it can feel that way. This is an instinctive, biological turning inward that happens as the body and mind prepare for life's final transition. Just as physical energy becomes limited and must be carefully conserved, so too does emotional and social energy. Social interaction requires significant energy. You have to listen, process what's being said, formulate responses, and maintain appropriate engagement. When the body is operating with minimal energy reserves, these tasks become genuinely difficult. The person begins preferring fewer, quieter, more meaningful moments over many superficial contacts. Families need to understand that during this phase, quality matters far more than quantity. A 5-minute visit where you sit quietly together can be more valuable than an hour of forced conversation. Respect their need for solitude without taking it personally. Remember that silence can be a profound form of love and comfort. Our fourth sign addresses something that causes tremendous worry in families, yet is one of the most natural parts of the body's final transition. We're discussing the gradual loss of appetite and thirst. When someone you love stops eating their favorite foods or shows little interest in drinking even water, every instinct tells you to encourage them. But here's what you need to understand. Their body is communicating clearly that it no longer needs or wants these things. As the body's systems slow down, metabolism decreases dramatically. The digestive system becomes less efficient. The stomach empties more slowly. When someone in this stage eats, their body struggles to process what's been consumed, leading to nausea, bloating, and discomfort. The organs are prioritizing their limited resources. The heart and brain receive what little energy is available. You might notice the mouth appears dry, with a coating on the tongue. Swallowing becomes slower and more difficult. They might take a bite or two and push the plate away, not from stubbornness but from genuine inability to continue. Emotionally, there's often a detachment from physical desires that extends beyond food. For families, the most helpful approach is to offer small amounts of whatever the person can tolerate without insisting. Ice chips or small sips of water can keep the mouth moist. Don't interpret refusal to eat as giving up. Understand it as the body doing exactly what it needs to do. Your role shifts from provider of sustenance to provider of comfort, dignity, and peaceful presence. The fifth sign involves progressive decline in physical movement and overall strength. This is when mobility becomes genuinely difficult, when moving from bed to chair becomes a significant challenge. Their steps become shorter, almost shuffling. They might lean forward as they walk. They reach for furniture, walls, anything stable to provide support. Several factors contribute to this decline. Muscle mass continues diminishing. Blood flow to the extremities decreases. Nerve signals that coordinate movement slow down. Joints become stiffer. This creates a challenging cycle where reduced movement leads to faster muscle loss, which makes movement even harder. Emotionally, there's often a shift from doing to simply being. The person who once defined themselves through activity now finds meaning in quieter experiences. For caregivers, ensure their environment is safe. Help with transfers when needed, but don't rush them. But remember that your presence, your reassurance, your willingness to simply be with them matters more than any exercise regimen. Now we come to the sixth and perhaps most profound sign. This involves subtle but unmistakable changes in breathing patterns and overall awareness. The steady, regular breathing begins to change. The rhythm becomes irregular, sometimes shallow and rapid, sometimes deep and slow. There might be pauses between breaths, moments of stillness that last 10, 15, even 20 seconds before breathing resumes. This represents the body's decreased need for oxygen as metabolism slows to its lowest levels. You might also hear a wet, rattling sound with each breath. This happens because the muscles of the throat have relaxed completely and saliva collects in the back of the throat. While this sound can be disturbing for family members, the person typically isn't experiencing discomfort from it. The person drifts in and out, sometimes seeming alert and responsive, other times completely unaware of their surroundings. They might speak to people who aren't in the room, people who've passed away years before. They might mention going home or talk about getting ready for a journey. These experiences are remarkably common and usually seem peaceful to the person experiencing them. Physically, the skin might feel cool to the touch, especially the hands and feet. The extremities might develop a bluish appearance as circulation concentrates on the core. During this sacred time, focus on presence, on gentle touch, on familiar voices speaking words of love and reassurance. As we bring our conversation to a close, let's step back and look at the bigger picture these 6 signs create. They paint a portrait of the human body, completing a cycle that began at birth. There's profound beauty in understanding this process, in recognizing it for what it is rather than fighting against it. These signs are not enemies to defeat. They're invitations to shift our focus from doing to being, from fixing to accepting, from prolonging to cherishing. For those caring for an aging loved one, you cannot stop this process. What you can do is provide comfort, dignity, and loving presence during this profound transition. If this information has helped you understand what you're seeing in a loved one, if it's given you permission to respond with gentleness rather than anxiety, please share it. Leave a comment telling us what resonated with you. Subscribe to this channel if you want more honest, compassionate conversations about aging and health. Share this video with family members, caregivers, anyone who might benefit from understanding these quiet signs. Take what you've learned here and use it to bring more peace, more dignity, and more love into the lives of those approaching their final transition. That's how we honor the journey. That's how we ensure that every person experiences the respect and gentle care they deserve right up until their very last breath.